Assalamualaikum and welcome to our online forum discussion. It is a great pleasure to have all of you here. Before we start our forum discussion, let me introduce myself and the panelists that will share their views on today's topic discussion. My name is Aini Faatihah binti ZOLKIFLEE, the moderator that will conduct the forum today. The first panelist that we have today is Dr. ALIF IZZAQLLUL bin YAHYA. The second panelist is DINIE AFIFAH binti SYAHRIZAN, a student from College Polytech Mara, Kuantan. And the last panelist that we have with us is Muhammad IKHWAN bin MAZLAN, an athlete. So the topic for our discussion today is physical health more important than mental health? As we all know, this topic is quite popular as some say that physical health is important while the others says opposite. Without further ado, let's ask our panelists what they think about this topic. Dr. ALIF, do you agree that physical health is more important than mental health?
Okay, based on your question, my answer is to disagree with that statement because mental health is our emotional, psychological, and social well-being all contribute to our mental health. It has an impact on how we think, feel, and act. It also influences how we deal with stress, interact with others, and make healthy choices. Mental health is extremely important through life from childhood and adulthood to adulthood.
So my next question, Doctor. Do you think that mental health is a serious issue in Malaysia?
Okay. According to the MOH 2050 National Health and Morbidity Survey, 29.2% of 60 years old and older have mental health problems, and 1 in 3 Malaysians have mental health problems, which is the highest prevalence among 60 to 90 years old and low-income families. Mental illness infect people at all age. Financial problem, unemployment, work-related stress, family issue, and marital discord. Poor parenting and other environment factors may have contributed to this increase. Poor coping skill and social support can worsen mental health. Despite effective treatment and mental health patient may not seek help to the social stigma or religion belief.
So, Doctor, why is mental health important for overall health?
In socially disadvantaged people, poor mental health lead to the poor lifestyle choice. According to the psychologists, drinking, smoking, and illegal drug use, poor diet, and unsafe sex can all be solutions to the problems depression and anxiety. And some bad news that the first 5 months of 2021 saw 468 suicide compared to 631 in 2020 and 609 in 2019. Family issue, emotional pressure, and finance was cited as cause.
Thank you for sharing your opinion, Doctor. I do agree with what Dr. ALIF said about poor mental health leads to poor lifestyle choice because without taking care of our mental health, it can affect how we cope with our life. For example, we frequently hear about the case of a suicide students, especially during the COVID-19 quarantine period. Some students cannot cope with the changes in learning, and those problems can lead to stress as they don't know how to deal with them. This is why I think that we need to expose more on how important mental health is. As I talked about student issues earlier, let us listen to Dini Afifah, a student from College Polytech Mara, Kuantan, on what she thinks about this topic. Miss Dini, as a student, do you agree that physical health is more important than mental health?
Thank you to the moderator. Personally, I disagree with that, and I think mental health is more important than physical health.
Why do you think mental health is more important than physical health?
Mental health problem can impact the academic performance and success of college students. Poor mental health contribute to a lack motivation and a poor concentration, which can lead to failing grades. Meanwhile, positive mental health focuses on developing an environment in which you can thrive and reach your optimum potential. Studying typically requires time and effort commitment as well as discipline routine to achieve academic success, which can put significant stress on mental health. According to the Ministry of Health 2015 National Health and Morbidity Survey, the prevalence of mental health problem among those 16 years old and over is 29.2%.
Besides that, Miss Dini, what do you think is the relationship between mental health and mental illness, which is commonly mentioned in society?
As we all know, mental health has greater impact on your quality of life than physical health. Our mental health is intimately connected to the mental illness that occur all around us, as mental illness can lead to disability. These illness include depression, anxiety disorder, panic disorder, post-traumatic stress disorder, bipolar disorder, and more. Untreated mental illness can cause severe emotional, behavioral, and physical health problems. According to the National Alliance of Mental Illness, about 1 in 5 adults in US experience mental illness each year.
Next is, as a student yourself, Miss Dini, do you know how mental health can cause a lack of confidence?
Lack of confidence is when they doubt who they are and what they can do. They often feel incompetent, unloved, and inadequate. People who struggle with low self-esteem are consistently afraid of making mistakes and disappointing others. At times, it always happens when students are often pressured by their own families, causing them to lack confidence when performing tasks. Among the signs is when students are often worried about the opinion of others. For example, parents who do not support their child choice and even tell them to follow their parents' choices. If a lot of things affect your self-esteem for a long time, it may result in mental health issue, which suggests depression or anxiety.
Thank you for sharing your views on the topic, Miss Dini. So the first two panelists shared that they disagree because they think that mental health is more important than physical health. So let's ask our last panelist, what does he think about this topic? Encik IKHWAN, as an athlete, do you agree that physical health is more important than mental health?
Thank you, moderator, for those questions. As an athlete, I agree that physical health is more important than mental health. Physical health, in my opinion, is one of the characteristics that is emphasized in daily life. We can see that various parties have made several efforts to urge individuals to preserve their physical health. For example, every Saturday in the second week of October, the government has designed a National Sports Day. This National Sports Day is a Ministry of Youth and Sports initiative, and it is a proactive step in the transformation process toward the objective of making Malaysia a sports nation. This demonstrates the government's attempts to encourage individuals to adopt an active living lifestyle. Physical fitness offers its own set of advantages. Strengthening bones and muscles is one of the advantages. If we examine attentively, we can see that the average Malaysian, especially old, has weak bones and muscles. This is attributed to a number of causes, including advanced age, a lack of physical activity, and a pervasive culture of laziness. It is not required to engage in strenuous physical exercise to preserve muscle and bone strength, but mild activities such as walking will suffice. However, it is important to note that excessive physical exercise can be harmful to the health.
I see. So, Encik IKHWAN, is there any other aspect that physical health can help our life?
Another aspect that I want to say is maintaining physical fitness might help us control our weight and avoid being obese. According to data, Malaysia has the highest rate of obese people in its population among Asian countries. This is not something to brag about, but it is something we must address. Other chronic disease may result as a result of this. Obesity is also linked to poor nutritional habits. As a result, we must eat a well-balanced diet while also engaging in regular physical activity.
So for my last question, Encik IKHWAN, what are the last benefit that you want to share with us if we take care of our physical health?
Yeah, last benefit is good physical fitness can help to lower risk of chronic disease. Diabetes, high blood pressure, and heart disease are among the most frequent chronic disease in Malaysia. These infections are extremely hazardous and, if not treated appropriately, it can be fatal. This disease is associated with harmful lifestyle practices such as poor nutrition, smoking, and a lack of physical activity. As a result, lifestyle practice should be instilled in each of them in order to prevent this disease.
Thank you for sharing your opinion, Encik IKHWAN. I do agree with Encik IKHWAN's point earlier. Taking care of our physical health can improve our ability to do everyday activities because being unable to do everyday activities is called a functional limitation. For example, doing a variety of physical activities can improve physical function and decrease the risk of falls or injuries from a fall for older adults. However, to conclude this forum, I think that physical health and mental health are both important for us because we often think of our mind and body as separate, but our physical health and mental health are interconnected. Physical health problems significantly increase our rates of developing mental health problems, and poor mental health is a risk factor for chronic physical condition. So the answer is simple, which is our body needs both mental health and physical health to function properly and let us live a happy and healthy life. So that's all from us. I hope that all of you enjoy our forum discussion today. Have a wonderful day and may your day be as sweet as your smiles. Thank you.